My journey to get here, that's a good question. So I think my first experience in anesthesia was actually as a medical school student. I did a mandatory elective and I had no idea what anesthesia was. Most people don't see it on the brochure of doctors, and realized it was the perfect fit for me. But I also had this desire to do all this other cool stuff in medicine, like deliver babies and take care of people when they're dying, take care of people when they're born and the sickest of the rural communities. And I think family practice anesthesia is the perfect opportunity to do that.
It's a one-year training program. Most of it's done in Saskatoon. During that time, the residents will rotate through the operating rooms in the 3 main hospitals we have here. They will also spend time working in our pediatric hospital, as well as the satellite Prairie View Surgical Center. They'll also spend a couple months on the obstetric unit doing epidural C-sections, learning how to care for those patients. They will also spend 2 months in Prince Albert, Saskatchewan in a smaller community hospital and have opportunities to work in smaller centers. They'll also rotate through ICU. Upon completion of the training year, our graduates will be equipped to provide anesthesia for low-risk patients having uncomplicated surgeries in rural Saskatchewan. They will also be able to care for obstetrics patients, providing epidurals and C-sections, and they will be a valuable resource to the emergency rooms in their community, providing airway, breathing, and circulation support for their patients and other physicians.
I think it's Canadian medicine's hardest job, best kept secret. You have the most responsibility with the most minimal amount of formal training. You need to be the right temperament, and you need to care sincerely, because when you're waking up out of bed in a small community to deal with someone who's super sick, you need to really care about that person, and the skills while you're learning them in the program here are going to pay dividends in the future.
Well, we have a good sim program. The biggest change is our program has gone from training 2 residents per year to 4 residents per year. There's currently a nationwide shortage of anesthesia providers, so this is going a long way to address that.
When you're in a small hospital in the middle of nowhere and the nurses can't start an IV, they look to you and you're like, okay, well, we need to give this guy IV antibiotics to save the guy's life. You have to have those hands-on skills to make that difference. When someone can't ventilate and you need to intubate the patient, you're the expert in the community that is responsible in doing that. And having the program of a family practice anesthesia provides the opportunity to develop those skills.